Hey everyone, what's up? Eric here with Just Eric Personal. So, something I wanted to put on here, alright, that I didn't get a chance to put on a few months ago. I forget how long ago it has been now, and I don't know, it just occurred to me. Yeah, story time. So I go to a doctor, okay? Anyone who's seen my Neurontin video, drug company video, whatever, knows I have chronic pain. At least they know it a little bit. So anyway, I go to a doctor and I say, well, first I go and I say, or my mom says, or he says, anyway, one of us says something about my chronic pain, and he says, hey, sometimes we can fix this by taking out the bars in your back, because I have my back fused, okay? I have rods, one rod on each side of my spine, okay? It's fused, and I've gotten screws and stuff going through my spine. No wonder I'm in pain, right? Plus I have spine bifida, which means that my back was open when I was born, and there was a nerve sac hanging out of my back, okay? So flat here, and then it comes out. Anyway, this isn't 3D, so you can't really, anyway, but so there was a nerve sac coming out of my back. So if I'm not mistaken, they cut that nerve sac off, okay? I have nerve damage. Now, so I go to this doctor, for regular, just, checkup, and he says, that he can help me. Quite possibly. So he's like, if you're still in pain, and, he gives me a frame of time. He's like, if you're still in pain, come back and see me, and we'll talk about surgery. I was like, okay. Well, I'm thinking, yeah, probably will be, because I know I have nerve damage, and, I do believe in miracles, but, it's, I was like, I don't know if it'll stop, so, so anyway, a few months pass, and I go back, and I wait 3 hours or something. I go and I get an x-ray, or a CT or something. I forget what the test was, okay? I think it was an x-ray, because, yeah, he wanted to see the rods in my bone and, my back and all that. And right away, when they told me I needed that test, I was like, oh, this is bad. I'm like, this I have a bad feeling about. So eventually he comes in my room after the test and everything, and he's like, so what can I help you with? And I was like, remember when I came, and I refreshed his memory. He's like, yeah. I'm like, okay, well, you told me to come back if I had pain still, and I do. So I want to see if you can take these rods out of my back. And he's like, just kind of staring at me. I'm like, so what can you do? And he's like, well, have you tried pain management? I'm like, yeah. It's like, have you tried massage? I'm pretty sure he, like, if I remember right, he went through a couple things. He's like, have you tried this? Have you tried that? I'm like, yeah. He's like, so what do you want me to do? I was like, I want you to take the rods out, like you said you would. You said it could help, and sometimes. He's like, well, I don't think surgery's gonna help you. Looking at me with a judgmental look. And I'm like, okay. And he's like, yeah, your rods look good. My rods look good. Okay, they look good. Cool. But I don't feel good. And see, last time I checked, a doctor is supposed to make their patient feel good. They're supposed to help their patient. Not just make their patient feel good, but do what is in the best interest of their patient. And this is. I know it is. I know my body. Okay? Better than he does. So anyway, you know, and he's like, hey, you know, I don't think it's in your best interest. I don't think surgery will help. I was like, okay, what can you suggest? He's like, exercise. I'm like, seriously? Exercise? I'm like, I've exercised and it hurts worse. And every time I do that, it hurts worse. And what occurred to me after he left the room is this. When you exercise, okay, the DOMS, the delayed onset muscle soreness that you feel, the, oh, my muscles hurt, you know, that feeling you get 24 to 48 hours after you work out, that's caused from, or that is caused from a lack of, or not a lack of, but a buildup of hydroxyproline, not lactic acid, like is common belief, but hydroxyproline. It seeps, okay, from your muscles, or it seeps, and then eventually it hits enough nerve endings to cause agonizing pain. Okay, so if there's that stuff that, you know, hits nerve endings, and I know this because I'm studying it, I'm studying nutrition, it hits nerve endings. Why would I want to exercise when I already have nerve damage? So it's going to cause 10 times the pain. Okay, point number one. Now, yeah, I was pretty much in tears by the time I left that office. And, yeah, for those of you who didn't see my weird haircut because of this, just for the sake of doing it. Anyway, and then this nurse who played like she was my friend and whatever, she, you know, she apparently told the people that I have depression and anxiety secondary to chronic pain, and they told me that I need to go get mental help and all that. They eventually sent me papers saying I need mental help. No. Okay. I was diagnosed with nerve damage. I know what my problem is. It ain't mental disability. People, if you're a doctor or something, and if your patient's telling you something, listen to them. Just saying. God bless y'all. Thanks for watching. Peace out. Eric here. Just Eric Personal. Signing off.